Hi everyone, I'm Gabriel Pereira. I am your host of A Modern Animal. In this podcast, myself and my friend Dr. Mike Woodrow will be digging into all things related to the life of a modern animal. Cats, dogs, horses, and the occasional fish, we will cover it all, building on Mike's more than 35 years of experience as a veterinary surgeon in Australian country practice, suburban practice, and more recently as the owner of businesses across the pet care space.
Hey everyone, welcome back to another episode of A Modern Animal. I'm Gabe Pereira, and joined as always by my co-host, Dr. Michael Woodrow. Mike, we meet again.
And we meet in very good company today, as always. Neal, just wanted to, on behalf of Gabe and I, just say how thrilled we are to be sharing this time with you and looking forward to a really invigorating conversation with you.
Yeah, excellent. It's my pleasure. Thank you for inviting me.
Neal, I'm going to just hopefully do you justice with your bio, and thank you again, echoing Mike's comments and thanking you for your time today. It's lovely to have you on the show. You graduated from Murdoch University in Western Australia as a vet, and you've got a veterinary practice specialised in small animals, from what I understand. But one of the interesting thing about, I guess, about your background is your integrative focus across traditional veterinary Chinese medicine as well, which you seem to have brought into practice in a really practical and applied way. So we're super excited to dig into that with you today.
Yeah, that's right. I guess there are a lot of vets who practices integrative treatments, but not many, I suppose, in Australia that focuses on traditional Chinese veterinary medicine as the sole focus in their practice. So for what I do, this is my main focus and my specialty.
Yeah. Amazing. And TCM, I mean, we know TCM from a human point of view has an incredible tradition, thousands of years of use and application, and is a full medical system, including acupuncture and herbs and everything else. I'm really interested in, maybe we can start there. How have you brought that across into animal, particularly small animal health?
Well, just a bit of a short background.
Please,
how I get into this.
You can do a long background if you want.
Because the thing is, look, not many vets will come onto this path because we don't get exposed to it. We don't see it happening and things like that. So I guess just to make it really really short, I was about 3 or 4 years out in practice when I got certified as an acupuncturist with small animals. And I was working in a busy hospital, and I started seeing these cases, cats that are coming in with luxated sacrum and they can't pee. And I had a cat that had a megacolon, so they can't poo. So they were my 2 first cases, and I spoke to the owners because the next step was euthanasia. Right. So I spoke to the owners. I said, look, I just qualify. I know a few things. Do you want to let me try? I won't charge you. I'll just do it for free. And I turned those cases around within about 2 weeks. And they're still alive up to this day. I'm still with friends. So that was about probably 8 years ago, and that really kickstarted my career moving forward. And it's funny because the more I did, the more I get involved in acupuncture, the more I get involved in traditional Chinese veterinary medicine, the less I was keen in my conventional practice.
Yeah.
So I told my boss, look, can I go into part-time because I want to explore a bit on my own. And she said, okay, you can go into part-time. And eventually I worked 1 day a week. And she said, why even still working here? Get on you're wasting my time. And so that's how I kickstart my career, on my own, and coming down this path. And ever since it's been about 5 years now since I've been doing purely TCVM.
Yeah.
And, I've never looked back. I've got, the cases I see, basically if the modern medicine, almost has reached the limits of what you can do. It's quite fun when you integrate treatments, acupuncture, you could, it's a gentle technique, most dogs don't mind. They don't even know I have a needle in my hand. They don't see it. And nutrition, herbal medicine, these are all very gentle techniques where I guess owners are more empowered to take health in their own hands, if that makes sense.
Yeah, of course.
Neal, I wonder if I could
Mike, please.
in, because I feel like we've kind of maybe joined the story at the pinnacle. Like it's really starting to get good. But I'm wondering, just even as some context, I wonder if we could hear about Neal, the person behind the professional, that might help us to understand some context about where your interest in these areas grew, or what your experience might have been as you grew up, and what.
Yeah. So, well, I was born in Singapore. I grew up in Singapore.
Oh, fantastic.
And I guess growing up, looking back, I've only been to the doctors twice in my entire childhood life. And I grew up with my grandmother, so we, it's interesting because at that time I have no idea. I have no idea about Chinese medicine, the traditions that we use, the food that we cook with. It's all integrative. It's all together.
It's just part of the culture, isn't it? It's just part of normal life. It
is. So things like looking back, things like if I start to have a cough or I feel a bit feverish, I have a bit of a sore throat, which all kids get, all the time. Yeah. She would make me some barley water. You drink barley water with a bit of brown sugar or something like that, or even coconut water. And I never really saw why we did that.
This is the heaty principle, right?
Correct. And guess what? We found out that barley water, coconut, these are all cooling foods.
Yep.
Because you are heaty, so we do the opposite. So we cool you down. So we I was exposed to a lot of things like acupuncture. I was exposed to a lot of herbs, and I have no problems taking herbs and things like that. But it's funny, when I went to vet school, it was so, I guess, I was so engrossed in learning so many things in vet school, and I will never ever do it again, by the way.
So, building on Mike's question, what brought you to veterinary medicine as a modality to study?
Well, I was about 16 when I told my dad, I want to go into vet school.
Okay, interesting. Yeah, how did you know? How did you know that was the career for you?
I don't know. I guess I was interested in animals as anyone else is, but as we progress through the vet school, like everyone will be, their priorities change and their interests will change depending on what you've been exposed to, what the stuff that you've seen and experienced. It brings us all to different paths. So my initial, reason for getting to vet school was, I really enjoy the wildlife. But then I realized there's no funding in wildlife, not much anyway.
No,
it's not easy to make a career out of helping wild animals. So then I started getting different experiences across the board, and then coming on to small animals, and then after a few years in practice, I saw there was a value in something else, and that's how I moved on.
So I've used acupuncture. I've been a patient using acupuncture, not as an acupuncturist, for essentially probably the last 20 or 30 years. And what I've found practically is that it's worked when just about nothing else will. Yes. Particularly for things like, which is surprising actually. So I went and had maxillofacial surgery, and reducing inflammation in that sort of very sensitive area. The thing that worked wasn't NSAIDs; it was acupuncture. And this is probably going to sound like a really dumb question. How does acupuncture work?
How does it work? Well, it's so our body. So basically, the principles of TCM can be transposed onto humans, dogs, cats, and horses with minor adjustments. But we're all connected by what we call meridian pathways.
Yep.
And that's why if you have a sore neck, you will feel better if we use a point, say on your hand, because that meridian connects all the way to your neck, if that makes sense.
Yep.
So these are all, I guess, part of the nervous systems, but a lot more specific, a lot more intricate than I guess how we understand it in the modern world.
Mike, I'm going to excuse myself for 1 second. I'm just going to manage that dog. Excuse me for 1 second. I'm so sorry.
I think it's completely fitting that during the recording of the modern animal that Gabe would have to step aside to just. I think it's also worthwhile saying that. Oh, look at that wagging tail. That's the beautiful thing. And he's back.
Yeah,
I'm back. Dog in hand. Dog in hand.
I like how casual this is.
I'm so sorry for the interruption.
No, that's cool. Yeah, so I was saying, our body is connected by, fascia. Our body is connected by connective tissue. So we can't say, our head's obviously not connected to the rest of our body. So there's a deeper concept, and I guess deeper meaning behind, the nervous system and how the meridians are all connected and how they reflect internal imbalances. So acupuncture is used to treat a variety of conditions, not just, inflammatory conditions. It's used for, headaches, used for seizures, used for anything to do with internal medicine.
They've also used it, I think, recently in humans, at least, as a way of prepare instead of anesthesia, right?
It helps. I think there was a few studies I saw that they did in dogs. They reduced the need for isoflurane on underg. Yep. Yeah, so there's a particular point they use on the toe between your second and third digits. It's on the liver channel. I know that. Okay. And only reason why that helps is because it's a point we use for pain and for stagnation. So if we can relieve that stagnation, we reduce the need for a higher percentage of isoflurane under general anesthesia.
Yeah.
Yeah.
Yeah. So I think you were saying your first experience with the application of acupuncture and TCM was in those two difficult cases, right?
Yeah.
Have you found, I guess, in the history of your practice, have you found that there's more of a preventative kind of prophylactic response now with patients, or is it still the ambulance at the bottom of the cliff? You're getting the stuff that they've tried everything else. Okay, Neal, what have you got, sort of thing?
It's probably the latter.
Is it really?
Yeah. So 80%, I would say 80% of my cases, they come to me because, look, we've done all this.
It's last resort stuff.
Yeah. Just tell me what I need to do.
Yep. Yeah.
But running my practice for about 5 years now, I have a lot of good clients who come to me or they speak, send their friends to me for more preventative health. But then that's where I suppose the nutrition side of things take over.
Yeah.
Rather than me actively trying to treat something or restore any imbalances. Yeah.
So what do you sort of see? I mean, so you've got a busy practice in WA. What are the types of common cases that you'll see in practice?
The most common one, as any other vets will see, skin allergies.
Really?
Yeah, skin allergies. I see a lot of heart issues, kidney, degenerative kidneys,
yep.
And even epilepsy. Epilepsies are one of my best type of cases I like to treat. So
talk us through a case.
Yeah, because seizures, from conventionally, a lot of cases present as idiopathic.
Yep.
They present very early in life, 1 or 2 years old, and we know that. And the question is, how many owners are willing to do an MRI or CT scan to rule out, brain stuff? Not many, in my experience. So a lot of them are put on, Keppra, phenobarbital to control seizures, but we know that long-term phenobarbital has effects on the liver. So
absolutely,
we watch the liver every 6 months, and we wait for, the way I see it's like waiting for a ticking time bomb. Yeah. Almost. Wait till liver, something happens, then we go, oh, okay, we do something now. So the Chinese medicine approach for seizures is quite unique because I'm looking for specific imbalances in that individual. I know the dog has seizures. I'm looking for, with seizures, the liver system is always involved. So ignore what we know about the liver conventionally. The liver has a broader and a deeper meaning. It controls our emotions. It controls our the flow of qi in our whole body. It regulates a lot of system. We call that the general of the war.
Yes.
So if your liver goes down, everything goes down together. So liver is very important. And from a Chinese medicine perspective, there are about 6 different patterns we look for. So that's when the tongue, we read the tongues, we feel the pulse, we look at the hair coat for any signs of heat, dryness, or greasiness, and things like that. And that gives me a pattern to work with. So are they, to put it simply, are they deficient, or do they have an excess stagnation that I need to resolve? So just give you a few examples here. So
go.
Yeah, I've had a case where this dog had chronic seizures for 4 years. She's only a 4-year-old dog, and she came to me. She was cold. I touched her ears. She was cool. She prefers to always sleep under the doona. She had a very dry coat with flakes on. Her paw pads were dry. She just lacks color, basically. She lacks energy. Because of the coldness, my diagnosis of her was a liver blood deficiency. So basically, the Chinese medicine way of looking at this is that if there's no blood in your system, we allow what we call wind, as in windy wind, to invade our system. And when you have internal wind, you get two things: one, headaches or seizures.
Really?
Yeah. So the whole idea is when you use acupuncture to treat these sort of cases, you want to treat the seizures, so you're expelling the wind.
Yep.
Second thing we need to do is to address the underlying imbalance that the individual is presenting. So if he or she is, say, liver blood deficient because she's cold, she has a pale tongue, she's got a dry and flaky coat, then we're going to nourish that blood, right? We're going to expel some wind. We're going to help the liver breathe. And then we're going to choose some foods that can specifically nourish those elements. And so that will be my treatment plan for that dog.
Yeah.
And whereas you can have another dog coming in, also having a seizures, no different otherwise, but this dog is aggressive.
Right.
This dog hates to be touched. This dog is a hot dog, red ears, red tongues, and really forceful nature, very strong and robust nature.
Hot spots on the skin.
Something like that. And if they've got strong femoral pulses, we're looking at an excess pattern. So this dog has a lot of excess stagnation, excess heat.
Yeah.
So that's why this dog's so hot, on the head and having seizures. Yeah. So with those cases, we are looking at clearing the heat, moving the stagnation rather than tonifying, rather than nourishing something. This dog doesn't need nourishing. This dog needs to be, calm the fan down, we need to calm the dog.
Yeah.
So the herbs and the treatment in terms of the points that I prescribe in acupuncture are completely different.
Depending on the individual patient, yeah.
Right, correct. Just like any people, any person, we might have headaches, chronic migraines, but everyone's a different body altogether.
Yeah.
So if you go to acupuncturists, the human acupuncturists will not tell you what they're doing because they don't need to.
Yeah.
They will just use points. They will just do what they need to do, and then you walk out the door and you feel better.
Yeah. How often are you cross-referring, inter-referring between, say, conventional veterinarians or veterinary specialists?
All the time.
Oh,
because,
okay.
Yeah, because I don't do any conventional lab work. So if I need blood work, if I need abdominal ultrasounds, if I need something, I'll send them away. It's a lot easier this way, so that we can get a good, reliable specialist report, and then I can work with what I know and help the patient. Yeah, because a lot of cases, I guess it's interesting, like with especially with gut issues, IBS, even skin allergies. A lot of tests will come back normal, if that makes sense. Yeah, you do a full blood work, and the owners will tell me it's all normal. Yeah, the dog's been vomiting, diarrhea on and off for the last 2 years, and you do a full abdominal ultrasound. Okay, minor changes, but nothing really serious going on. We're not sure why. We just treat as we go. So these cases are really, I enjoy these cases a lot, because when I get long-term resolution of the problem, the pet parents will be forever grateful.
Yeah, exactly. Well, it's these hard to treat cases and it's no reflection on a conventional veterinarian. It's just outside of their skill set, right?
It's a different medicine altogether. And I said we can't really compare them because they do different things.
Yeah.
So sometimes I need something quick. I need antihistamine shots. I need a dexamethasone for quick inflammation and things like that. But then outside of that, when it wears off, what happens? That's my area. What happens outside of that?
Neal, I'm thinking about our common experience as human beings is when we see something different is isolation. And so even as a profession, especially if it's something that we don't understand, usually difference leads to disconnection. I mean, in a healthy society, it leads to curiosity. But oftentimes different means bad. And so I'm wondering, What's been your experience within the veterinary profession? So I see that as you interact with these pets and as you interact with these pet parents, like there'd be a deep and ongoing, personal, really satisfying connection. But you've also got to exist within your professional, your peers. How's that experience been for you?
I know where you're getting at. Well,
he was very deliberate in that question, wasn't he?
It was. It's interesting because how do you say? Initially, I guess everyone wants some sort of recognition. With the stuff that you do, you want to be recognized, but that's kind of fade away after my first year. Okay. When I was, as I said, when I was in the hospital and I was doing acupuncture, none of my colleagues cared what I did. I guess it's because we're not educated. We don't know that area. We don't understand enough. So, we don't know what to ask. We don't know what to ask. So they, most of them are quite indifferent. So they don't really care what I do. They just say, look, do whatever you can, work your magic, that sort of thing. But when they see the result, that's when they start asking questions. So, basically I had, one of the cases was a basset hound that had this surgery 6 months ago. And he, after the surgery, till 6 months later, he was still walking with a towel under his belly. And this basset hound was 35 kilos and the owners were in their 70s. Yeah. And he needed help to go to the toilet every single day until I saw him. Wow. And I go, oh my God, this is impossible. And I said, look, would you be willing to try? I give myself 4 or 5 treatments, and if we don't see anything, and I'll stop. So we did about 4 or 5 treatments, and every single time this dog would walk in with a towel under his belly. On the 5th treatment, he walked in himself. Wow. Without, and all my nurses on the reception saw that, and that's when half of the hospital, the staff I work with, all flipped. They couldn't believe it. So that's when they show more acceptance with what I do. But I guess with the general population, the general profession on its own, I don't get specific referrals for issues. It's more like, say for instance with allergies, we've done the whole lot. Yeah. We've done the Acupuncture, we've done the Saddle Point, and I get vets sending clients to me and say, look, try him. Yeah. See what you can do. That was the exact words. That was the exact words. And only after they've done basically quite aggressive treatments for 2 years and not getting any response, so they go, look, you probably need something else. Yeah. But it's not about them knowing, understanding what I do. It's more about there's nothing much we can offer. So go down another path. Give it a try. Yeah. Yeah, give it a try and see what you get from it. Yeah. Yeah. I mean, there's only one of you, Neal, I know you're building a practice. How does someone living in Queensland or Brisbane, what do they do if they want to get access to these sort of treatments for their animals? There is a few around. Is there? Okay. Yeah, but it's not, you're not easy to find because you're not easy to find because you need, I guess, depends on how they're advertising it, but you need the keywords, and most of us don't advertise. We don't blatantly and put it out there and say, hey, this is what we do, because it's the general population still don't quite understand where this is coming from. So a lot of them a bit more sus about, what is this guy doing? We're not sure. Yeah. So they're less likely to approach me as a fresh face. And even vets, general, they don't refer actively like this, because they would try a lot of things as we would, going down different paths before we start giving up. So it's there are a few around. I know that I think there's a directory that you can search. Okay. But I'm not sure. I'm not sure. Yeah, because we don't talk a lot. We're not very involved with other vets promotion around the States. But I'm trying to form a list of vets who does TCVM and try to get them together.
Well, it's just such a valuable modality, whether it's the primary modality or adjunctive or, as you say, case of last resort.
Yeah, I like
it's
that.
just, it's so valuable for the animals. And so, obviously whatever we can do to get the message out there, we'll do that. I've got a curly question for you. Chinese herbs, typically astringent, bitter, kind of disgusting.
Yes.
How do you manage that with your patients?
Well, first of all, probably only half of them are quite bitter, to be honest. So nourishing herbs are more sweet in nature. So those are
so licorice, for example.
Yes, so those are more well taken up by the dogs. But I use a lot of powders and some tablets. So I typically, obviously with the diet perspective, I try to get them on a kind of a fresh, wet diet.
Yep.
So it's a lot easier. But with any dogs, with any herbs, I always tell my clients, start slow and start easy. Don't give the full dosage.
Yeah.
Because if you scare them, if you, as I say, in my words, if you piss them off, we lose the entire plot straight away.
Yeah.
And with herbs, we know that it's for the long term, because we're trying to resolve imbalances. So it's more for long term. We're talking about 2 or 3 months at minimum. So we can't, I always say we can't afford them to not eat this. We need to
go slowly.
If they are happy to eat them, then you'll be surprised. Like some of the herbs that are so bitter, and I've tried it myself, and I said, this one's going to be really bitter. Just go easy, and dogs lick every single bit of the bowl. And I've got clients saying they eat better with the herbs on. So then, okay, well, that's a win-win for me.
So what do you think? Is there any truth to this sort of idea? How dogs with digestive problems will go and eat grass, or they'll go and eat bitter herbs. Is there any sense to that sort of native intelligence of the animal to find their own medicine? Is that, or am I just imagining that?
Well, I think eating grass has got half of them I see because they're bored. I think because I cannot for the life out of me, I cannot detect any imbalances in those dogs that I see.
Oh, really?
Yeah, so it's funny, it's weird, but then the other half seem to have some sort of gut issues where I suppose the chlorophyll in the grass in the green helps with the liver and things like that. That's the only way I can understand it.
Yeah, me too.
Obviously, some dogs with severe behavioral issues, they mow the grass, and these dogs are just not eating for fun. They have a behavioral problem.
There's something going on.
So I think dogs are quite instinctive, and most of them, if I can get the owners on board, intuitively, I feel that if owners are, confident, agreeance of what we're going to do, I think most of my dogs, the patients I see, feed off that.
Yeah.
So they feel, empowered. They feel confident that the food is safe to eat, and they, instead of forcing them and go, come on, you got to eat this, and if you don't eat this, I'm going to take it away. So I work from a slightly different angle because all I'm trying to do is to make them happier. Make the dogs happy, make mom and dad happy, and not create more stress in their life. So
exactly.
So I think. As we know as vets, Mike, most of the job here is talking to, getting the owners on board. And if you lose that relationship, you lose everything.
Yeah. You've got to talk to the 2 legs before you talk to the 4 legs.
I like that.
It's never, I guess, as vets, it's never about the patients in a way. It's always, it's always the owners, because, we're so good at what we do that it doesn't take us long to find a problem, but it's about what happens in the background. I think that's what we don't know.
Yeah.
I see dogs go a bit funny when families have kids, and it's not abnormal because the routine is all out of place. Yes. All that sort of thing all comes into play. So when I see my patients, I understand the family, what's going on. Why are we having anxiety issues? Why are we having stress vomiting, that sort of thing. So it all plays a huge role. And obviously, if emotions are involved, from a Chinese medicine perspective, there's a common imbalance that I treat, especially with gut issues that suddenly come on board for no reason. And the same with people as well. We know stress causes a whole range of things like bloating, indigestion. people get stressed fast,
Yeah.
So all these things are, fairly common in dogs. So just that, so for me, I'm seeing it from my perspective. So I'm seeing a lot of, this sort of imbalance or this sort of patterns that I can treat. Whereas if I were to work from a more modern conventional perspective, then I'm looking for purely symptoms. If a dog walks into me for vomiting, but then, wagging his tail and jumping like there's no tomorrow, he's probably okay.
Yeah.
But then we know that if he's been vomiting once a week for the last 2 months, okay, there is something going on.
Something's there. Yeah.
So whether it's a dietary thing, whether it's a stress vomit, whether it's, that's where my consults come in. So, that's why my consults about 45 minutes to an hour long for each dog.
Mm.
Neal, I'm glad you brought up that topic, because when we started and Gabe asked you about some common conditions that you treat, and you were talking about skin, about locomotion, about epilepsy, but we have been in some conversations recently where we've talked about the mental health of our pets and just them integrating. What kind of home environment are we creating?
Yes.
What are the flow-on effects to them? And then even our experience as the human society the last couple of years, it's been a fairly unbalanced time. I'm wondering, as you look back on the 5 years that you've been in practice, are you seeing trends in this space?
Yeah, absolutely. A lot more, a lot more, especially, people getting pets. Some of them getting pets almost on an impulse.
Yeah.
Or, they already have two dogs and, we're getting another one.
One on a third.
just because. And obviously we're hoping for a healthy, dog. But sometimes things don't turn out that way, and it becomes more, exponentially more stressful as well. And then I guess with the pandemic and everything, we've had a lot of lockdowns and, a lot of restrictions. Humans are stressed from their careers or, jobs and things like that. And dogs are very intuitive beings. They feed off emotions. They don't necessarily rely on how you look or what you say. I think that's how I see it. So
yeah, I agree.
The intention, the way you sleep, if you have an interrupted sleep or you're having a lot of vivid dreams, dogs feed on that, I think, and then creates a whole lot of stress on a different level that is hard for us to objectively quantify.
Yeah.
Only when issues happen or when it causes enough imbalances internally, resulting in gut issues or degeneration of other organ systems, then we start going, okay, let's start focusing on these areas. But as much as we want to create a stress-free environment for our dogs, we can only do our best.
Yeah.
We can only do our best. If I've got a family with 3 kids and 3 dogs running around and 3 dogs have completely different needs, it's almost an impossible task for one person to try to manage everything like that.
Yep.
I just look at, sometimes I look at my clients and go, I don't know how you do this, but I'll try my best. I'll give you a plan. I'll give you a plan, but I'll simplify it. I'll make things simple. So
how often are you creating a remedy for the pet parent?
Most of the time I try to understand their background a bit and see if they're a family with no kids, or if they have if they're caring for their parents and things like, because I've got everyone's so different, and trying to understand their perspective can really put the treatment plan in a better shape, rather than giving them giving them an ideal plan. Okay, you got to do all this for the best of this dog, because there is no compromise.
Yeah.
Sometimes I go, okay, we have an old dog with a bit of arthritis. To put it bluntly, they won't die from arthritis, but then if we were to say you got to do these massages every day, we got to go for rehab once a week, it may be impossible for them, and creating more stress on top of the whole thing. So then how about we keep things simple? We have a simple nutrition plan. Yep. We get them on some herbs. We make things simple, and then we review and see how we go. So everyone's a bit different. If I've got someone who works from home, and I've got a dog with say, I don't know, say kidney failure, and we need more homemade diets that may need more time, I'll go all out on this one. I'll say, look, this is what I think will be best, and if you can achieve that, we build on that, and we make more. We make it better. We can do more supplements. We can do more herbs. We can alternate things around, so we can have more a detailed plan for these guys. But yeah, it's it's a very different approach that I have for these patients.
But I think I just want to double click on the point you made earlier, which I think is the essence of this conversation. Your perspective on the pet parent and the animal is more than the symptomology that they present with, right? It's right. Okay, cool. To use your example, the old dog's come in, he's got osteoarthritis, but what's your familial context? What's going on at home? What's the stress levels like? What can you manage from a resources point of view, time point of view? So I love it.
And the thing is, everyone has a different view and expectation on things like, an aging dog and arthritis, things like that. Some owners want complete pain coverage.
Yeah.
They want to be able to do normal things like, how they would have been doing 5-6 years ago, which may be not possible. Then we load them on NSAIDs, we load them on, painkillers and things like that, which are obviously helpful. But then we also need to look after the other aspects, the kidneys, the gut, and all that stuff.
Yeah.
Whereas some owners come in and go, he's still getting into the car, he's still getting around his daily activities, he still gets on the couch with no problems, he has the occasional limp, but he's a happy dog.
Yeah.
And so it's about managing their expectations. I want to know, when they come in, what are you looking at? What's on your mind? How do you feel? Because I have a very objective view on things like that. And my views may not always necessarily suit yours. So if they are, they agree that, okay, it's an aging dog and, a bit of inflammation is normal, like we all do, then we may not always have to load them on NSAIDs. So it's always a very differing view that I have to quite quickly understand in the first 5 to 10 minutes. Otherwise, the conversation doesn't go anywhere that anyone agrees. Yeah.
Neal, I'm wondering if we were to look a little further ahead, thinking about your life mission.
Yes.
Which is
my life mission.
I'm thinking about what part of your life mission is the betterment of pets in your community and helping those families, and what part of the mission is in terms of a broader education, both in the human community and the veterinary community. And no answer's right, but I'm just wondering, what does the Neal of the future look like?
So a couple of things. I have a couple of final year vet students coming on and off every now and then. So it's opened my, I guess my horizon in terms of what I may want to do in the future. But one thing I want to do is really to, perhaps educate more vets about the benefits of integrating, holistic treatments. It doesn't have to be TCVM. It can be, nutraceuticals.
Nutritional medicine. Yeah, exactly.
Yeah. Anything that are beneficial because, first do no harm, right? So, and there's a lot more research coming out as well. So we shouldn't be turning a blind eye on things like that. Even though we have no, going through the vet school, we have no training or exposure to things like that. But it doesn't mean that.
Is that right? There's no modules on this at all.
Not much. Because there's so much focus on I guess the gold standards. There's so much focus on other species of the animals that there's just not enough time. So
I mean it's an intense course, isn't it?
It is. That's why I never want to do it again. So so like for me, look, my focus is more animals, dogs, cats mainly.
Yeah.
I can never do anything with horses. I can't do anything with pigs either. I've got friends who are purely equine vets, and I can't expect them to do the same for a dog or a cat. The level of understanding, the connection we have with these animals are so different.
Yeah.
Because they exude a different kind of aura altogether. Horses, it's a different level. To me, they're a different level to a dog, which are more, closer. They sleep on your bed. They're more intuitive. They're more, you can train them to do different things, where horses are used for a different purpose altogether. So from that perspective, so there's no room, there's no time for during vet school exposure to other modalities.
Yeah. I mean, so it's I think to Mike's point, it's got to be postgrad, right? Or it's got to be the apprenticeship model where someone comes and works with you as you're doing with these final year students.
Yeah, and then obviously with the vets going out and work, it all depends on what they get exposed to. The cases they see, the clients they meet, they bring them down a different path altogether. I'm sure Mike will agree with that one. Yeah. But also, I'm currently probably a year away, but I'm working on a book.
Nice.
On breaking things down, in terms of TCVM, for vets, for pet owners who want some understanding on what TCVM can provide.
Yeah.
As a form of integrative therapy, because a lot of my clients are when they see the results, they're interested in, wow, this is interesting. But I always tell them that you can rarely apply the same technique, the same principles that I told you for this dog for another dog, because they're two completely different.
It's individualized treatment, right?
Correct. So a classic example, I had a client with with a dog that was classically a hot dog, just hot all the time, panting, lay on the towels and never sleeps on the bed because he's just so hot. And then the other dog, on the other hand, it's a very quiet dog, feels the chill all the time and prefers to lay on the bed. So one's a hot dog, one's a cold dog. So then when I apply my principle, especially when we talk about food therapy, using the energetics of protein, hot and cold proteins, we're just trying to find a balance. You can't give a cold dog lots of cold foods because they will go chilly by the end of the month. Yeah. And we are, in that way, we are purposely causing imbalances which we may not want to see. So it's all about getting that balance, and that's what TCVM is all about. We just want balance. So if you're off that way, we bring you back this way. If you're off this way, or bring you back this way. Yeah. So it's as what some of the professors have taught me, it's very, they put it very simply, but they say it's very simple. Once you find your pattern of imbalance, you do the opposite. Yeah.
It's homeostasis, right?
Absolutely.
For the individual. And I think that's a good segue, because I think one of the big areas that Mike and I think about a bit is obviously supplements, but food, right? So 9 times out of 10, the pet parent is their main interaction from a nutrition point of view is going to be the animal's diet.
Absolutely.
What do you recommend? I mean, again, assuming resources are not the issue, time's not the issue, what would you recommend to someone?
In terms of nutrition?
Yeah.
So I've always.
So what about that dog behind me? Like, no major issues, bit of a pain in the butt. What should he be eating?
I guess it's interesting, because when we talk about nutrition, we always look back at what's the ancestral diets like and things like that. Yeah. So for me, it's a bit of a mixed one. I know some vets would push for a raw diet. Some vets would say raw is it's dangerous. So there's always a lot of many conflicting views, but I'm in between. So, I'm happy for raw. I'm also happy for cooked diet for this guy. It all depends, because some of the young, robust dogs, I'll put them on the raw diet, no problems. Yeah. But then some of the older ones who are more deficient may not be able to handle raw as well, because they're so cold, And from a TCVM perspective, raw foods, same apply for humans. Too much raw foods, too much cold foods actually consumes more energy in terms of when you're trying to digest them. So it leaves you more tired afterwards. It gives you, that's why some people will have things like bloating if they drink too much, cold juices and things like that. So it all makes a lot of sense. And, some of the cases I've seen, for instance, a dog who's been on raw diet for 10 years and then suddenly gets these gut issues where he has this spasm every month, and you end up in the ER, and it causes a lot of stress. And mom was convinced that this dog needs to be on a raw diet, because he has been for the last 10 years. And when I saw this dog, and I go, he's got this imbalance where I feel like a cooked diet will be more gentle on the stomach. Yeah. And it took me 6 months to convince her because she didn't believe me. And so she ended up in the ER 3 more times before I saw her again.
Oh, man.
And by that time, she was like, yep, tell me what I need to do. so we go on a cooked diet, and 9 months forward, he's fine. He hasn't gone to the ER.
Yeah.
Hasn't had any more blowing. So I'm kind of in between. It all depends on my TCVM assessment. So this is where I guess I'm a bit more different, a bit more unique. When you're using tools of TCVM, because you're looking for the imbalance, looking for individual differences, I just cannot apply my principle and say, look, every dog needs to be on a cooked diet, or every dog needs to be on a raw diet. It just doesn't work that way. I just can't say it. But a fresh diet would be something that I've always advocated for. And then there's a lot of talk. Obviously, we know that it's going to be, things like it's going to be complete, but it's never going to be balanced.
Yeah.
But, with these sort of arguments, I've always looked back and go, well, no other living thing on this earth eats a complete and balanced diet every single day.
Exactly.
So I've always said, when I come up with my diet plans, I always have foods that you can rotate throughout. And I think that's the essence, like how we eat, as long as you eat enough foods from the right food groups, it's really hard to go off balance, because the only way you can cause disease is if you keep eating fried and greasy foods,
yes,
and lots of dairy, then you're asking for trouble. But if we eat, as I said, a very balanced diet, same with dogs as well. In my 5 years, I've only got better results. I haven't got any dogs that went backwards. So there's a lot of conflicting and arguments around this area, which is a very, very hot, big can of worms if we open this up.
Yeah, it is. And I think just for clarity, when you say cooked, you're talking about, quote, real foods.
Correct.
By the owner. Yeah.
And I'm aware that there's a lot of pre-made, commercial options out there as well, who are all, pre-made, cooked and ready to go. And I love all those as well. There's no problem. It's just that obviously then we always come back to the argument where, are they balanced? Do they follow the standards? Are they within the guidelines? But then we also need to remember that I feel personally, we need to think about how the guidelines are set. With the trace minerals and the vitamins, probably half of them have a minimum requirement, but they don't have a maximum limit. So with commercial diets, that bit is kind of unregulated. So
it's self-regulated, right?
It is. So some dogs, so the things like copper and iron, these are trace minerals, and some dogs might need more, some dogs might need less. But how do we define how much that dog needs, how much I need? We don't know. No. And if you have underlying health issues, then your requirements change drastically as well. So it's a very big area here, which makes it so complex, which is why when I do food therapy, and this is coming back to Chinese medicine, and using energetics of protein and grains and vegetables to suit the individual needs, this is where I get a bit more relaxed, because I'm just basically choosing foods that I can sort this imbalance out. And then I'll come back later to kind of make it a bit more balanced for these guys. And we'll review the diet probably once every year, every 18 months, just to make sure that if the imbalance has been resolved, then we don't have to keep sticking with this diet. We can give some variation. We can introduce other foods. We can use supplements and things like that. So it's, I don't know, I just look at this and go, I just think of how, humans, how I eat, and how the owners would eat. And I try to kind of integrate both together, because a lot of real foods, a lot of fresh foods are not difficult to get. Most owners have them in their pantry. And so why is it so difficult?
Yes.
You could do a bulk cook.
I think and this is the, I think the argument for your book and your soon to be released video series. There's just a lack of awareness around this among both pet parents and I think people who have animals with issues as well. Because I think I would tip the cap to your grandma as well. I think my wife's Singaporean as well, so there's an intuitive cultural understanding of things like heating and cooling properties.
You understand that?
Yeah. So in the West, that it doesn't exist. No. It doesn't exist.
No.
So I think there is an education gap, I think, that we need to help bridge.
And Neal, just to also just by observation, I think one thing that we've noticed is that your approach is very respectful. It's a very complete and holistic approach. It's fairly pragmatic, just in terms of trying to think how can the interventions that we bring also balance the available resources from both the pet and the pet parent. So I think, as I've heard you speak, the culture that's behind the positive that you bring, it's really healthy.
Yeah, I love that, because obviously I've been, I had 5 years in practice before I went on to TCVM. Not a whole lot, but enough. But that taught me a lot in terms of how we communicate with our clients, how we communicate with our owners, because a lot of compliance, things that you can't control happens, I guess. 1% of the time is when you have control, is when you're in that room, the consulting room. 99% of the time is when they're out.
Yeah.
So if there is no respect, if there's no if they can't do it, then it's pointless. It's pointless.
Yeah.
There's no pragmatism to it. I like cats. I've got 2 cats, and the biggest thing is try tableting a cat with medication.
Exactly.
It's a no-go. I hate doing it. I can't do it. So when I get cats coming in when they're on 4 tablets a day, I look at mom and go, how do you do it?
How do you do it?
It's impossible. Like, are you serious? You can do this? So it's always about trying to, how to say, because if this is going to be the cat's life for the next 12 months,
it's got to be sustainable.
It's not sustainable. Someone's going to give up. The cat's going to lose their mind. And so,
okay, I need you to reveal some of your secret sauce, Neal. So, not acupuncture, acupressure. So supposedly, as we were saying earlier, 70% of dogs in particular, and cats, I think, are experiencing anxiety, so according to the stats.
Yes.
What, if any, are some at-home acupressure points that I can use on these dogs, please, to help relieve anxiety and help calm them down?
Well, in fact, there's a few simple points we can use, but just remember that's only 50% of the work.
Okay.
The other 50% is always, the owners. What in the world is going on in the house? Do they have 10 dogs or what?
Just two.
So there's one dog on the dog's forehead, and if you run your hands down, you find a V.
Yeah.
Not humans.
Let me see if I can find a willing participant.
Yeah, you feel a V shape, and where that V ends.
I can see it. Yeah.
I mean the dog in your house you're sitting with, that would be quite obvious, but that point there, it's one of the calming point. Even we use in humans. Is right up
at the bridge of the forehead, is it? Or
so here as well in people, but I don't use this in dogs. This is very dangerous to use in dogs. Okay. Quite close to the eye. But one up here in humans, but in dogs is right on the V.
Okay.
And then the other 2 points is literally there's a depression on your on the side of your temporals. Yeah. So normally, you can press 3 at once, and it's a nice calming point for them.
Ah, very cool.
It works really well for dogs who have reverse sneezing fits.
Okay.
So how dogs, they do this reverse sneeze.
Yep.
Sometimes because of dust, sometimes because they're anxious or just really excited and they just can't get out of it. And so really sometimes I just hold them, I press those buttons, just hold them for, 3 or 5 seconds, and they just snap out of it quite quickly.
Love it. Thanks. The secrets.
Secrets to calming, but acupressure, acupressure is quite powerful, especially I use it a lot for muscular issues and dogs who have gone through spinal surgeries who may be weak in the hindquarters. They really help to root the energy down the back. There's a point I use on the foot underneath the big paw pad, almost like having a foot reflexology massage. It may not mean anything, but when you've done it, it makes a whole lot of difference to the recovery that we see. Yeah, they get more sensation in their legs. They don't trip over as much. They and things like that. So I get owners to do some acupressure at home, only if they can comply. If they can't do it, then I'll save my breath. But one, my consult's 45 minutes an hour. It's probably not enough. I could talk all day.
I love it. I'm just wondering how we get one of you in every single vet practice around the country.
But it's not sustainable. It's not sustainable.
But I am thinking about the evolution of change, and you were talking about your exposure to final year students, and I guess each of us as professionals have had times when we've had an apprentice type role. And what I've noticed over the decades is those apprentices go on to be clinicians in university and then leaders in university. And so we're talking about decades of change, but it's a worthwhile change.
It is.
So I can see that you're already both through the mentoring that you're doing as well as in the future publishing that you're doing, is that you're going to be changing the level of wholeness that's being applied to veterinary education, as well as the level of awareness amongst pet owners around other options that could be, that they could explore before they get to the point of desperation. So, Neal, I think you're on a very worthy path.
Yeah, thank you. I mean, I guess in the last 6 months, I've had. So I see a lot of cancer patients as well.
Yeah.
In the last 6 months, I've had more referrals from oncologists, which is a bonus.
Yeah.
There are a lot of cases, as you know, that chemo treatments can be quite limited.
Yep.
Things like hemangiosarcomas, and there's not much you can really push on. So I guess it helps because it's a slow path, but the reason I'm getting more referrals from oncologists is because of the cases they have seen. The results they've seen when patients are being integrated with treatments, they get less, like almost none, gut issues at all on the chemo drugs.
Right.
They get way longer survival times and increase in remission rates. So it's quite fascinating. I just cannot explain it, but TCVM is quite cool. Even I'm shocked and surprised sometimes. Like cases like lymphoma. We know the survival time is pretty short in dogs. Unless you hit them with chemo, but even with chemo, there's no guarantee sometimes.
Yeah.
I've had I have a couple that went on for more than 18 months and went to remission when they're on integrated treatment. So from that perspective, it's been really positive and really beneficial for me to even learn as a practitioner going forward, and hopefully that also helps expose and educate specialists who are way ahead than me.
But I think the paradigm. This is the interesting thing, because I think the paradigm in integrative medicine, particularly in the States, around these sort of end of life care situations, from a human point of view, is already there. So your equivalent from a human acupuncturist point of view already exists inside most integrative medicine practices in the US, for example.
Correct.
Which is great. So I think we can actually learn from the human context and bring that into animal medicine versus the other way around.
It's actually much more common in the US.
Totally right.
Yeah, we have more vets doing TCVM in the US, and even South America and Europe. I've got many colleagues I know who are doing it.
Yeah.
And it's quite cool because I understand, coming from Singapore, I can read, I understand Chinese, I can read Mandarin. And think so it's a lot easier when I go through the herbal course, and understand acupuncture points, why they're called certain names.
Yeah.
But it always makes it always I'm always very impressed by non Mandarin speaking.
The Waigoren.
the people who who can learn just as well. It's incredible. And when we speak the same language, it's so easy to talk to with colleagues who've gone through the same path. It's amazing, incredible.
Well, Neal,
I love it. Yeah, I think, Mike, I reckon this is round one.
Yeah, absolutely. There's more to learn here. But yeah, Neal, along the way, we just really commend you, and also just to step back and to realise the role that you'll play in Australian, both in the veterinary profession and also in pet ownership. So I think you've got an important role to play here, as well as just your local role of serving pets and pet parents.
Yeah, but I'd echo that. I mean, I just want to thank you for firstly your time today, but also for your commitment to try and elevate the understanding of TCVM in Australia across what we're doing here. So I really appreciate it.
It's a very foreign term, TCVM, but I wish, I hope, and in the near future, more, even more younger vets coming through will be more, keen to, even explore, and not just, I don't want them to be doing more TCVM, but just explore the niche area that will give them, even better results, with more sustained positive outcomes. Yeah.
Wish you well.
Awesome. If you'll come back, we'd love to have you back on the show.
Yeah, absolutely. It's been great. It's been fun.
Thank you. And I apologize. The postman needs some acupressure after engaging with these dogs.
It's funny. Yeah, it's funny. You've got two dogs in the background giving you.
Yes.
Giving you a hard work.
Yeah. Thank you again.